executive plastic surgery. So very interesting case. 55-year-old patient comes in with grade 3 capsular contracture on the right. She has silicone implants from 2007. The one and only set. And so she comes in with the symptoms of breast implant hardness on the right side. And as you will see, she's gotten the 100% total capsulectomy 10, 2, 25 initials NM. And so grade 3 capsular contracture. So right was the end block place. If you look at this, this is more like oval shape. And if you look at this one, this is 100% total capsulectomy and more round, if you will, on the left side. I removed the excess skin plus that incisional scar. This is the only way you're going to be able to, with an incision this reasonable, to be able to dissect all the way into the upper chest. And so on the right side end block, the gold standard, 100% total capsulectomy. So if I look this up, just by touching it, you can see it has a different consistency compared to that one. That one's more firm. And so this is kind of automatically like a red flag that this is going to be what is ruptured. The other thing here to note here is, if you see, this is the rib, the cartilage part of the rib right here. So this was a question one patient asked me last night. Why did you remove the fascia? So if I leave the fascia behind, you're going to cut into the capsule, and now the whatever the internal contents are going to leak out. Now we had no clue going into the case that the right side or the left side was going to be ruptured. Now as I dissected, having done thousands of these, just by touching this I can tell there's a problem inside. You can see this is the fascia of the intercostal muscle. Look at the fascia right here. See this shiny, glistening white? This is the fascia. In order for me to remove the whole capsule, the fascia has to go. So if the fascia remain behind, the capsule will remain behind. And there is no ill or harm by removing the fascia. Look, we remove cartilage to reconstruct the nose when doing rhinoplasty all the time. And we take other parts, for example, the tendon here, to do a tendon transfer or reconstruction of the hand. So in order to do the surgery correctly and properly, the fascia has to be removed. And this is where you can see the fascia of the serratus anterior fascia of the intercostal muscle, the perichondrium, periosteum has to be removed. And that essentially authenticates what is an end block. And so none of the internal contents are going to spill out. What's the worst thing that's going to happen? If you ask me, is this ruptured implant spills into the chest, and then the surgeon tries to wash it, and then you spread it around even more, and then you let this fall into the chest. Now what's interesting is, you see F-150 trucks go over these implants, and then everyone swears that they're the safest things on earth. This is not cohesive. This is not a gummy bear. The implants disintegrate. They are not lifetime devices. Look how thin the capsule is. Believe it or not, look right here. Here's your fascia. See that nice streak right here? See that line, that shiny line? If you ever see muscle, sorry to gross you out, on the grocery store you see meat and you see the fascia on top of the muscle, that's that shiny thing that's sitting right on top of the rib. That has to be removed in order to do, because I cannot dissect the fascia from the capsule. You have to incorporate this. So all the way around, I'm very happy and content. Look at small pieces of silicone right here, all contained. Look at the way how this is melting away. This is supposed to be the nicer, better, safer gummy bear. In 2007, they were introduced into the market as safe. And I'll tell you, there's absolutely nothing safe about this implant. If you look at it, if you show this to a third grader, they're going to want to not even touch it, let alone let it be in the body. And so this goes to showing you, you have seen all sorts of implants. Look at the way this literally fell out, right? And look at the way how it is molten, right? It is not gummy anymore. And look at the way it's like a jellyfish, if you will. And look at the shell. The shell of this implant is different consistency than the internal content. You should go on YouTube and see how they make implants, like the manufacturer of the implants. So as you will see right here, none of this spill into the chest. That's why the end block is key. Anyone who says end block is not important needs to just look at this video right here, and they will understand why end block is key. Now I have a sterile pair of gloves. Remember, I'm going to get good cultures from the inside when I do my cultures, and likewise on the inside of that I have a sterile pair of gloves. I see some surgeons do it with nitrile regular gloves that are not sterile. Look at this kind of a band right in the middle, very thin capsule. Remember, in this lady, she had a very low BMI, nice, smart lady. She had very, very thin capsules. And remember, all precious volume. So remember, the breast tissue was not touched. That was above the muscle. So as you will see right here, this is an intact implant. So as you will see on the back of it, if I go and pick up some, look at this. This is the leaching, the gel bleed. This is your McGann 304, just like the patient stated. Look at the color difference, if you will, as it gets more denatured. This is your very ultra thin capsule. You can see no matter how thin it is, it has to be removed. And the entirety of this implant capsule, all inflamed tissue is removed, leaving behind only good healthy tissue. So in a normal human being, below the muscle, which is the pectoralis major muscle, you have pec minor and then the ribs. So there is no extra precious volume that's going to be removed. So as you can see, the implants will be returned to the patient, capsules to be sent to pathology, rule out the BIAL, CL, CD30 analysis. Absolute no need for drains. It was literally 5 cc's of blood loss on each side. No need for a lift. Overall, I'm very happy and very pleased how the breast tissue recoiled, even on this nice 55-year-old. High definition pictures and videos of the chest while showing complete removal of the capsule. This is by far the single most important take-home message. You have to ask for those high definition pictures and videos of the chest wall, and certainly this, so when you put the two videos together, you have the complete picture as to how the surgery went. Twilight deep sedation. The capsules are sent to pathology, cultures for Arabic, anaerobic, and fungal. No need for lift, no need for the drains. And the surgery is done in the same manner that I have done all the other patients, so that there is no burden, no capsular burden, no inflamed burden, and everything, all the badness is contained, and a full comprehensive workup is done. This is the con procedure. There you have it. Executive plastic surgery.